So good afternoon, everyone. As we celebrating the sixth year of Cypher, it's an honor to welcome you all for this special event, Modern in Tobacco Control Enforcement of Anti-Tobacco and Nicotine Law, Experience from Physical to Digital, Transforming COTPA Enforcement. So first and foremost, I extend my heartfelt gratitude to our esteemed guest of honor, Dr. Rana Singh, sir, Director Tobacco Control Southeast Asia Region from Vital Strategy, and Dr. Sandeep Bhalla, sir, Vice President, ECO India, for their valuable presence and support in advancing tobacco control efforts in the region. I also warmly welcome Mr. Sanjay Seth, Trustee and Chief of Operations, Sambandh Health Foundation, along with Mr. Pramod Kumar, Project Manager, Sambandh Health Foundation, for sharing their valuable insight on leveraging digital interventions for effective COTPA enforcement across various districts. A special thanks to our leader, Dr. Rakesh Gupta, President and Director, Public Health CIPHER, for his visionary leadership for driving this movement. Finally, I extend my sincere appreciation for all the participants and attendees. Your presence make this session truly meaningful, and I hope today's discussion inspire further action toward healthier tobacco-free future. So, as we know, January is recognized as uh, Cancer Awareness Month, an important time to raise awareness of prevention and screening of connection between tobacco use and cervical cancer risk. To shed more light on this, I now invite Dr. Rakesh Gupta, sir, from CIPHER to speak on this topic. So over to Dr. Rakesh, sir.
Yeah, thank you all for joining. And thank you, Rajiv, for introducing me. So, the Cervical Health Awareness Month is observed in January every year. And the goal is to raise awareness about the cervical cancer, its prevention, and early detection. As you know, the key facts are that cervical cancer is the second most common cancer among the women in India. HPV vaccine is there, that is the human papilloma virus vaccine. It can prevent most cases of the cervical cancer, and the PAP test is required to detect the cervical cancer and the risk factors. Tobacco use is a major risk factor for cervical cancer, and multiple sex partners and weakened immune systems increase the risk. Tobacco use, as I told you, that it is a significant risk factor because of the weakened immune response, direct damage to the cervical cells, increased risk of HPV persistence. Because of these factors, women who use tobacco have a higher risk of developing cervical cancer, especially if they also have a persistent HPV infection. So over to Rajiv. Rajiv, please introduce Dr. Rana Singh and Dr. Sandeep. Dr. Sandeep has to go early. So
Okay.
please
So,
introduce him early. Yeah. First, you may introduce Dr. Sandeep.
okay. So thank you. We have our honor to introduce our first guest of honor, Dr. Sandeep Bhalla from ECO India. So Dr. Sandeep Bhalla, sir, is an alumni of Armed Force Medical College, Pune, and in community medicine. He is a public health professional with 22 years of experience. He is specialized in roll out a large capacity building initiative in India and Southeast Asia towards strengthening healthcare delivery both in public and private setting. Earlier, he worked with the NACO, DFID, and PHFI, and currently he is leading the project at ECO India as a vice president. And he has won various awards in national and international forum on the capacity building. He is honorary advisor to NHM, Nagaland, Sikkim, Arunachal Pradesh, Kolkata Municipal Corporation. And he is also the visiting faculty for AIMS Jodhpur, PHFI, IHMR, and MAHE University. And he has more than 50 publications and also has fellowship in public health leadership from Emory University, US. So over to you, Dr. Sandeep, sir.
Thank you. First of all, Mr. Ravi. Let me first congratulate CIPHER and their whole team for their 6th year anniversary. Respected Dr. Rakesh Gupta, sir, President and Director, Public Health, CIPHER. Dr. Rana Singh, sir, from Vital Strategy. Mr. Sanjay Seth, the Sambandh Health Foundation. Mr. Pramod Kumar from Sambandh Health Foundation. Ms. Tamanna from Cypher, and all the takers of this today's initiative on models in tobacco control and enforcement for anti-tobacco and nicotine laws. We all know that the sir has already mentioned about that this month is a cervical cancer month, which we are celebrating globally itself. And already there is a talk has already started before this month celebration started by the Union Ministry that the cervical cancer vaccination is going to come over, and we are going to make it as a part of a universal immunization program. And very soon we are expecting that this is going to act as a big boom for our reducing the mortality among our young girls and the females, because 9 to 14 years is the age factor which we have decided. And as per WHO strategy 90-70-90, globally people are working on cervical cancer screening and also the vaccination strategies in different parts of the world now. Just to update you that Eco India is there is a consortium which has been created in India known as Cervical Cancer Elimination India Consortium, and Eco India is the capacity building partner for that consortium. And the Ministry of Health and Family Welfare has prioritized 100 districts to start the cervical cancer vaccination first. So this is a consortium of various organizations like Engender, Japigo, and various other institutions. And IIT Delhi is the secretariat for that. Now coming to the this particular initiative, which Dr. Rakesh Gupta from the CIPHER is leading, let me tell you that this is a dire need, because oral cancer, we all know, that's one of the major and the common cause among the males in our own country. And India is the second largest producer and consumer of tobacco products. If you see from the Gates 1 2009, 10 to Gates 2 2016, 17 prevalence of any form of tobacco use has decreased significantly. But there are certain states where the prevalence is still high. The implementation of the law, particularly the COTPA, is crucial for effective tobacco control in India, and simply enacting legislation without proper enforcement allows for widespread tobacco use and undermines the intended health benefits of the regulations also. So I think that the key points about the implementation of the law in India is access to tobacco and the public health impact, advertising restrictions, and social norm change challenges to the implementation, and also tobacco cessation services. These are the things which we have to focus in times to come also. And let ECO, being a not-for-profit organization, extension for community healthcare outcomes, we are working extensively in the capacity building arena since 2008 by creation of a trust in India. And we are working with 29 state national health missions all across country. 20 AIMS are on board with us. We have associations like eminent institutions like NEEMHANS, NHSRC, NHMW, Tata Memorial Hospital, NITRD, and we are the telementoring platform for 6 national programs in the country also now. Our purpose is only one: let the knowledge should move, not the providers, because that is the ethos of ECO. And we should have a democratization of the knowledge so that the knowledge should reach to the last mile at right time with right at right place with right outcome, because the outcomes which all of you are looking by running various training initiatives you can get in a impactful way. We work in a diverse sectors. The model is agnostic, and we work not only in the health, but health is our 95% of the portfolio. And I'm very thankful to the leaders like Dr. Rakesh, who are acting as one of our torchbearers and champions to take up this battle of tobacco cessation and other initiatives through CIPHER. And I'm regularly getting their updates on my WhatsApp that this session is happening, that launch is happening. Thank you, sir, for giving this opportunity to me. And on behalf of my own leadership of Eco India, I would say it's a great fortune for all the takers of today for this particular session, and enjoy this wonderful learning experience and fruitful journey. And rest assured that you are going to get best from all these key opinion leaders, because getting their time, otherwise it's very, very difficult. But as they are committing for the cause, I think it shows their commitment. So salute to their commitment, and let's have a very fruitful discussion in times to come. All the best, stay safe and stay healthy. Thank you, sir.
Thank you, Dr. Sandeep. Thank you. Yeah. Rajiv,
thank you, sir, for your address. So next we are honored to have.
Yes, please.
Okay, so now we are honored to have Dr. Rana Singh, sir, from Vital Strategy to share his introductory remarks. So, okay. Dr. Rana J.
And
Singh
Dr.
sir
Rana,
is
before that, I think we can have a snapshot because before Dr. Sandeep Bhalla leaves us, so we can have a snapshot if all people there open up their videos, switch on the videos,
so
please.
we request all the participants, please switch on your video for some time.
So we can carry on if you have taken the snapshots.
Okay, sir. So we are honored to have with us Dr. Rana J. Singh sir. Sir is a Director Tobacco Control Southeast Asia Vital Strategy, which sir has played a significant role in influencing tobacco control law and policy in India. Our pulmonologist, Dr. Rana J. Singh,
चलिए
supporting
ठीक
the
है
center.
थैंक यू वेरी मच
Yes, sir. Over to you, sir, for your
ओके
address.
ओके थैंक यू वेरी मच
Yeah.
तो गुड मॉर्निंग good afternoon all of you respected Dr. Rakesh Gupta ji president Cypher team of RCTC Dr. Sandeep Bhalla vice president ECO and team Dr. Sanchika we can see for the last almost many years we are seeing her support to all those work which is happening here. Chief speaker of today's webinar, Mr. Sanjay Seth and Mr. Pramod Kumar from Sambandh Foundation. I can see many stalwarts here. So Dr. Rakesh Gupta ji from Rajasthan Cancer Foundation. We have Ashima Sarinji, Mr. Ramesh Gandhi, chair of Rajasthan Tobacco Free Coalition, all the participants. Uh, so, good afternoon once again. First of all, congratulations for starting this new series of webinars with focus on tobacco control. And I think first webinar is really very, very important. Before I really go to the topic of today's webinar, so I would definitely like to share my experience of tobacco control with focus on enforcement. You see, when I joined as a full-time worker in early 2007, there was already a law. There was already a tobacco control law. You know, our tobacco control legislation came into being in 2003. I was a little bit involved earlier also, being just a physician. Yes, there was some engagement because even before COTPA, there were many laws. 10 states at that time, they were already having some kind of tobacco control laws, which also includes the state of Himachal Pradesh, where I was working. So, in addition to that, there was a law in Delhi also. So, few states were doing some kind of enforcement and restriction of smoking at various public places. You know, there are four provisions of major provisions, I would say, in our law. Smoke free, that is Section 4, Section 5 test ban, protection of youth provisions under Section 6A and B, and Section 7 graphical health warning. Law came in 2003. Even there were earlier laws, but there was hardly any enforcement in the country, even after having the law there almost 4 to 5 years, except a few cities, which includes definitely city of Chandigarh, city of Junjunu, where Dr. Rakesh Gupta ji, who is here, who were trying to make some efforts to enforce the law, that time COTPA, Section 4 of, and then definitely the city of Delhi. So there were some efforts of enforcement of legislation, whatever the knowledge the people were having at that time. So what was the gap? Why there was no enforcement even after 4 or 5 years of legislation? Hardly any challan was done till then. So basically, the gap was that there was no SOP, standard operating procedure, rules, which we often say. There was no manual or guidelines how to enforce various provisions of legislation. Who will do what? How to do that? There was major capacity gaps. So just as an example, then came 2008 rules, October 2008 rules. Everyone, you know, you know, which impetus to implementation of smoke-free policies. At that time, strategies were developed, hundreds of trainings of law enforcers were done throughout the country. Field visits were organized, so enforcement officials were taken to fields, how to actually show them how to enforce those laws, those provisions, role plays. So in that way, that was a very humble beginning. Uh, uh, from our side, we also worked with many states to develop an enforcement mechanism. So that was very, very important. That there was how to have an effective enforcement mechanism. So enforcement mechanism means to constitute enforcement teams and squads, maybe printing of challans. There was no challan at that time. There was no challan. There was no receipt books. Secondly, where this money will go, the challan money, where money will go. So heads of accounts, they were created in different states. Then there was no support for mobility. So all those things, reporting of violation, whom to report when there is a violation. So all those challenges were there. Then actual enforcement at grassroots level, that was very crucial. At that time, I still remember many cases used to go to the court. People were referring the simple compoundable offense, Section 4 and Section 6. They are compoundable offense. But because the enforcement officials, they were not trained throughout the country. So many cases they used to send it to the court, which is a burden on the additional burden on the courts. So there were some gaps and challenges. There were no IC activities. So for enforcing a law, even so, it is very important that public is informed about the presence of the law, why the law is being informed, is being enforced. So these things were not there. So that was the beginning. At that time, we also supported the enforcement with many opinion polls. So we conducted almost 20 opinion polls, which were conducted by premier institutions like PGIMER Chandigarh, Don Bosco Institute, maybe many universities, Singhania University, then SRM University. Throughout the country, many opinion polls were done. Compliance assessment studies were done to show to the authorities that please see, public wants smoke-free public places. Public wants that there should not be any smoking. So opinion polls, they supported even smokers. Even smokers want that there should not be any smoking at public places. Compliance studies were done to show that compliance is very poor. So we need to enforce the Section 4 of legislation. So in that way, that was the beginning, and there was excellent public support for implementing tobacco control laws, despite all the interferences, despite the difficulties which were having. Multiple agencies were involved at that time. Health is because under the law, you see, there are so many enforcement officials which have been authorized to enforce various provisions of law under Section 4. 21 category of officials have been authorized, but whether all were active, perhaps not. So many efforts were made to involve them, each of them, and that they need to see that the public places, if they are not going out, they need to enforce the law within their own public places. If there is a railway station, they need to enforce there. If there is a post office, transport, bus stands, so all public places. So that was something which was done in a big way to involve health, police. You see, health officials are not traditionally they are enforcement officials, but I think many states definitely gave a responsibility. If I see the enforcement system of 30 plus states, every state has its own way. Some there are few states where health is at the forefront. Then there are states where police is at the forefront. Many other agencies like for cities, corporations, municipal bodies, there are health inspectors. There are, for example, in city of Mumbai, it was majorly it was FDA. It was the sanitary inspectors, health inspectors of municipal corporations which were involved in city of Mumbai, and not the police in a big way. Then rural development, education, transport, tourism. So there were major departments which were involved for enforcement of law. So I think we have traveled a lot. India has traveled a lot since then. But if you ask me, what is the current status? Enforcement of tobacco control laws is variable across the country, across the district. Even within a state, if one district is doing some good work, other may not be doing that kind of work, and it all depends on perhaps the official district nodal officer, the other officials within that district. So sometimes it is a person driven thing also. One thing I learned a lot from the then the nodal officer of government of Delhi. Uh, so we need to enforce the law, enforcement in such a way that law it becomes self-enforcing. So law becomes self-enforcing when people are aware that why this law is there, and when people are aware that someone is looking at them, that someone is looking at them. So this is very important. At that time, thereafter, we do not have to make so many efforts. Otherwise, we will continue to challan people. We will continue to see involvement of uh, of all other departments, and involving everyone. People are different departments. They are busy with their own work also. So in that way, this is very important that while enforcement is happening, how it is supported by public support, awareness generation, IC. So this is all very important. So for today's webinar, there are two aspects. One is definitely main. What is the main aspect? It is enforcement of the main discussion. Second is know how to make it more maybe cost effective, more happening as far as recording and reporting, smooth. How that can be done? How we can really see that? So there are two aspects. So first aspect, actually, I have already mentioned that actual enforcement of legislation at ground level is very crucial. There is a law, it has to be enforced. So everyone must understand that simple awareness and simple IC activities are not alternative to enforcement. People often say, whenever we go, often authorities tell us, often leadership tells us, Rana ji, let's let's educate people about the law. But so simply, let's educate the people about harms of tobacco. So whether that will help in enforcement, very little. So there is a law; it has to be enforced. There is no second alternative to that. So that should be very clear to everyone who is involved in enforcement activities. Authorities have to penalize, have to punish whosoever is violating the various provisions of the law. And now we need to see that how we can reach to the ultimate last mile, that is up to the village level. Enforcement has to be at village level, where even a pradhan or sarpanch or village president is authorized to penalize a person, where a panchayat secretary is authorized to penalize a person. So first aspect is enforcement, that yes, it cannot happen alone with IC, it cannot happen simply with the trainings, but we thereafter we have to go to the field. Second aspect is now recording and reporting of enforcement activities. what is the best way, how we can make it maybe most foods, and we can streamline that part. So definitely the role of digital technologies in almost now in many aspects of tobacco control, that is there. Tobacco cessation, I think it's an important area where digital technology has an important role. Efforts have been made in the past also in tobacco cessation. I think globally and here in India also we have some good experiences. National Tobacco Quit Line, mobile cessation, M cessation. They are some good examples here in our country. Thereafter, now people are also trying to use WhatsApp to inform and to help a tobacco user to quit. Now, the biggest example is now NTCP, Management Information System, MIS. Earlier, we used to receive copies, district reports in hard copies, but now it's through that system, and you will be happy that currently 700 plus districts they are entering, their report. They are entering their quarterly report in that system. In that way, that gives Government of India, that gives the Ministry of Health a snapshot of everything. Which state is doing good work in different indicators, which is a state which has not done even a single SLCC meeting, which is a state, which are the districts which have not done DLCC meetings, then enforcement activities, tobacco cessation activities. So there are many indicators for state level, district level, and an excellent example of use of digital technology for strengthening tobacco control. Enforcement activities are also reported. And if we see, still there are many districts across the country there who are not doing or doing very little enforcement activities. Hardly few challans in a whole year. So that is something. So enforcement has to happen, and then we need to see how we can use digital technology, maybe where every violation can be reported, and then corrective action can be taken. So I think we have an excellent panel today on different issues. After Shri Sanjay Seth ji, I have seen the work which Sambandh Foundation and its team is doing across many states. So I think let's learn from that experience and see how we can use those technologies for monitoring of enforcement, recording and reporting of those activities. So once again, thank you very much. Welcome, Sanjay ji, once again from my side also.
So thank you, sir. Thank you for your address and highlighting various issues and achievements of the interventions. Thank you. So moving forward, we have a key presentation from physical to digital, transforming COTPA enforcement. And this session will explore innovative method and digital strategy in enforcing the COTPA Act. I invite Dr. Rakesh Gupta, sir, to introduce today's speaker of the day.
So thank you, Rajiv, and we are actually honored to have the team Sambandh Foundation. It is led by Mr. Sanjay Seth, who is Trustee and Chief of Operations, and Dr. Aisha Masari, who are leading very efficiently. And we'll have Pramod ji with us for the presentation. So Mr. Sanjay Seth is currently Trustee and Chief of Operations of Sambandh Health Foundation. He manages the Voice of Tobacco Victims too. 4 years he has got as the Director for Campaign for Tobacco Free Kids working on tobacco control. And he has 29 years of business experience, of which 25 years is in information technology. Mr. Pramod, he is Project Manager, Sambandh Health Foundation. He is a public health professional. He is a public health professional with 12 years of experience. He holds a MBA from Ranchi University and has successfully implemented COTPA in 70% districts. So we'd like to hear from them. Thank you.
Thank you, Rakesh
So,
ji.
Sanjay ji, you can share the screen here.
Yeah, so Pramod will be sharing the presentation.
Okay.
And while he is setting it up, I'd just like to give a few introductory remarks, and then Pramod will do the presentation.
Okay.
And after that, in the question and answers, we'll try and respond together to any questions you have. I think, as my dear friend Dr. Rana pointed out, this law came in 2003, and till today, we are struggling to get an enforcement mechanism in place. I think there is a need for tobacco control group to introspect why has it not happened. Let's look at the numbers. All India, the excellent MIS which Vital Strategies has put up shows that only 5 lakh challans are made under COTPA. We have 28 crore tobacco users, and I'm sure that many of them, most of them, are violating COTPA almost every day. So the number of violations which are taking place across the country are very large. It runs into crores and crores. Now, in comparison, if you see road safety, traffic challaning, all right, then traffic challans, there are about 30 crore vehicles on the road. And any vehicle will make maybe 1 or 2 violations in a month or less. So in comparison, the violations of traffic violations are much less. About 1.5 lakh people die because of road safety issues. In our tobacco, 13.5 lakh people are dying every year. So the deaths are many times more, 10 times more. And yet, if you look at it, we make 5 lakh challans in a year. Chandigarh alone is making 8 lakh challans a year. Tamil Nadu made 5.5 crore challans during 2019 to 2023. They're making 30,000 challans every day. So if you want to do tobacco control, all right, what is the point of having a law if you're not enforcing it? There is no impact taking place. There is nothing happening. And as I said, we in tobacco control need to introspect deeply why our focus is not there on enforcing this law. If after so many years, those of us who worked for 10 years, 15 years in this area, need to seriously think, why have we not been able to get enforcement done? There is no point talking of other things unless the things which are already in place, the laws which are already in place, we are not enforcing those. So we in Sambandh have been focusing on implementation, whether it is COTPA, whether it is toffee, and now we have started focusing on villages, tobacco-free villages. And I would like to now, I think we have made some remarkable developments in how to do enforcement of COTPA. That model, we used to do it earlier physically. We worked in 10 states. And with COVID, we transformed that model into a digital model, which we are finding is far more effective, less costly, and gives far better outcomes. So I'm going to hand it over to Pramod to tell all of you about how we are enforcing what is our model. Pramod, over to you.
Thank you, Sanjay sir. And thank you the opportunity from Eco India, sir, and Dr. Rakesh sir, and our today's speaker, Dr. Rana sir. Good afternoon, everyone. I am Pramod Kumar. As Rajiv sir has already introduced me. And today I am here to present a physical to digital implementation on Cigarette and Other Tobacco Product Act. This presentation will highlight the Sambandh journey from physical to digital enforcement and how this transformation has led to more effective implementation. Our goal has been to ensure strict enforcement of this law and protect the communities, especially to the youth, from tobacco addictions. So let me present the Sambandh work as we have done in pre-COVID. We started our work COTPA implementation from Haryana with Haryana Police in year 16 to 18. And in between these days, we have achieved 100% district active, 55% police station active, and more than 50,000 challans done issued by Haryana Police, and 65 lakh plus amount collected for this COTPA implementation. If I am talking 100% district active, means all the district from Haryana, they have enforced the laws, this COTPA law, and they have deposited the money in the treasury account. So after this Haryana, we moved to Delhi Police, and with the experience of Delhi, we have achieved higher success rate, and we have activated all the districts, 100% district active, and 85% police station active. Delhi Police has issued 1,36,127 challans as per our record, and more than 2 crore rupees fine collected for this COTPA law. So, however, both the states, Delhi and Haryana, relied on physical methods, and which posed some significant challenges for implementing this physical method of COTPA implementation. And what are the challenges? I show you. Very slow and labor intensive, data collection difficulties, individual motivation and follow-up, limited behavioral tools, and of course, very difficult to monitor. While we are going to police station, it is taking too much time. Going to district to activate the districts and meeting the officers, taking so much time. Sometimes we are sitting in the office of DSP and we are not going to meet a single DSP. So it is a very time taking and not able to accelerate how we are thinking to make this COTPA implementation. And of course, without data, you cannot measure and monitor which police station is doing and what level. We have maximum more than 200 police stations in Delhi Police, and it is very difficult to go each police station and make them motivated to do these activities. So follow-up itself is a big challenge to all the police stations, and that time you don't have any limited, very short, limited behavioral tools to make them motivated and make the good strategy and planning to activate all the police stations. But during the COVID, Sambandh Health Foundation has worked a lot on digital program implementation. Sanjay sir is guiding us all the times ki the time has changed. Technology has come. AI has come. You have to work according to the demand of the technology, demand of the era. And after this COVID, Sambandh has transformed this digital information method and we start implementing this method in Meghalaya. We are still working in Meghalaya, and sitting in Gurgaon, we are able to activate all 100% districts within 6 months. Able to activate all the police stations within 6 months, which we couldn't do in Delhi and Haryana. Meghalaya is very small states, and now perhaps we have achieved 18,000 challans issued by Meghalaya Police, and more than 24 lakhs fine collected for this special act. Similarly, we have followed this digital method in Andhra Pradesh, is a big state. We got 9 districts to implement this COTPA implementation, and I'm happy to tell you we have achieved this 100% activations in this state also, and we have 64 police stations now active on this to making challans, and every month they are reporting to us. Till now we have 16,000 challans, and they have collected 17 lakh rupees fine for this COTPA implementation. So our digital method has been well proven to more effective, scalable and sustainable implementation of this act. Sambandh is working in 3 other programs in Meghalaya. Tobacco Free Village, as sir has already said about this. Tobacco Free Education Institution, we are working. School Health and Wellness Program, we are working there. And if you can see, all these programs, the commitment from the police force has been instrumental in all 3 programs. In the picture, you can see the police officers' involvement for a cause. Now, the Meghalaya police is more sensitive to make the schools tobacco free outside the boundaries. Our TOFI team always help us to provide a list of schools having shops selling tobacco products. And the same list we are providing to the superintendent of police, and we are requesting please forward this list to your OCs, your SHOs, and every SHOs having their areas, particular area list, and they are going to those schools and searching this shop if they are selling tobacco products or not, and they are sometimes they are requesting and also finding them. If you are selling tobacco products, we can seize your also shop. So now slowly we can see the cleanup of all the tobacco products nearby the shops, and is away from the youth to access the tobacco products. They are the futures for our future generations for our country. And if we stop tobacco consumption here from the schools, in coming future we will have a very good number of prevalence in every state if you are working similar kind of a strategy. Additionally, we have prepared a WhatsApp group for Meghalaya Police and Andhra Pradesh Police. Meghalaya is very small state, and we have only 128 police stations. So we have more than 250 officers on board on our WhatsApp group, and they are very much active on the group. Every day they are posting every day they are posting data and challenge figures, amount, and the pictures for public place smoking, nearby the school smoke, any violations. Similarly, we are having a similar kind of WhatsApp group in Andhra Pradesh Police. We have more than 600 officers on the board, and in this group we have additional SP level, DSP level, ASI, SI on the group, and they are very much active on the group. They respond, and they do clapping for their police stations, and they have a competition. I have to post my pictures on the group to show my bosses. Till evening, till night of 7 o'clock, 8 o'clock, 9 o'clock, they post their photos on these pictures on this particular group to show them their bosses. We are on the field, we are working for a cause, we are working to make our areas tobacco free. I hope you have heard about a very famous Hindi idioms. Kharbuja ko dekh, kharbuja rang badalta hai. And this is the strategy we have followed on our group. One police station is putting the group pictures, other also start putting, no, I have also done some good work. And I tell you, in one day, one police station is doing more than 20 chalans, 30 chalans. So it's gradually happening, increasing the chalan numbers day by day. And we are seeing here, you can see every month we are receiving reports from each SP office. And we are providing this list to our tech team. We have a backend force. They are developing a dashboard. And through this dashboard, we are able to monitor each police station, which police station done and what levels, so that we can make a strategy or plan for every police station to make them and strengthen and empower to make a chalan in their areas. Activate them as others doing. We are also giving time to time some appreciations and some appreciation and awards to make them motivated. You can see here is one trend of one of our digital implementation state, Andhra Pradesh. You can see in month of June, we have July, we have 624 challans. The next month, it goes up 1300 challans. In September, it goes to 1900 challans. In October, 2400 challans. October 24 and November 3200 challans. So it is gradually increasing with our different level methodologies. We are follow up monitoring. It happened and it is increasing day by day. Before July, it was sort of challan because there's a sort of supply of challan books from health department, but now it is very much available in the state, and it is our graph is going up. So I can say this COTPA implementation through digital implementation is very much sustainable, scalable, speed, and impactful. I think you also are very amazed at how it's happening, how this police station and every police station is doing for COTPA implementation, where every citizen, maximum citizen is struggling to lodge an FIR, and there is so much competition to making challans and putting their pictures and showing their pictures to their bosses without getting any single amount from our side. We are only giving appreciations, and for this our this particular things our BIO team has worked a lot. I would like to say thank you to my BIO team. They have analyzed very deeply a study to analyze the psychology of the policeman, and they have guided us to please call your police super protectors. They are heroes. They are a champion for us because for the cause they are going on the field, doing challans and reporting us. This is a big thing for us as an NGO. I can show you one student from Meghalaya. He's writing appreciation letter to the Meghalaya police. Dear Meghalaya police, thank you for keeping our schools tobacco free. So this is a new generations. We are getting support from the every corner of where we are implementing this COTPA Act. So thank you so much for your time and opportunity for this to present my experience and transformation from physical to digital implementation. Thank you so much, sir.
So thank you, Pramodji and Sanjayji, for sharing your excellent work. And it is really impressive that you have done so much in many states. So 2018, you started from Haryana, and they were very impressive. 50,000 challans issued by Haryana police, and 65 lakh was recovered from the violators. And then you worked with Delhi police, and you could activate all the districts in the Delhi, and 1 lakh plus, exactly actually 1 lakh 36,000 challans were issued. And it was difficult to collate and monitor, so you found the digital tools to monitor it better in Meghalaya and Andhra Pradesh. And March 22 to December 24, 18,000 challans were issued in Meghalaya. That is very impressive. And in Andhra Pradesh, from August 23 to December 24, 16,000 challans were issued. And you are also supporting tobacco-free villages and tobacco-free education institution guidelines. So that is very commendable. And commitment from police officials is showing in both the states. And it is very interesting that WhatsApp group officials, they are very active in both the states. And most of the officials, they are active in posting the number of challans or whatever activities they are doing. So thanks a lot for your presentation. And now the forum is open. You may stop sharing, and then we can have discussions. If you have any questions, you can just ask questions in the chat, or you may ask yourself by unmuting yourself. So thanks a lot. So Dr. Rakesh Gupta, I think initial comments from you.
Thank you very much, Dr. Rakesh ji, and best compliments to the Sambandh team, and had been exposed to their work earlier also in this year when I had visited their center. And I consider it's a very, very useful work to be replicated in the rest of the country.
Yeah.
I know the commitment and the engagement of all the three team members who are here. I'm just trying to look at the methodology which has not been detailed here as to how Sambandh gets into Sambandh with the states in which they are working. So I think that is one query I have for Pramod or Sanjay ji or Ashima to tell us as to how this can be done. And I was also looking at the figures given and the average uh, penalty which has been charged. And generally, it goes above 100 rupees per challan, which is very, very commendable, I would say. So, if that is working, I think it's a great thing to have, because I know of some states where the people have not been charged very high, and the numbers have been inflated and they have got the national award, etc. So I think what is the strategy? Because affordability is definitely one of the issues here as to how this can be, how this has been done. So this is my second query to them.
Okay,
Over.
let me answer that. Your first question is, what is the mechanism? So first thing is we need to understand is that for not just enforcement, but for any program, you need to work with an organization. All right. Now, in enforcement, the existing organization in the entire country is the police. Right. Now, we have been looking at ki just because in COTPA there are many other people authorized to challan. All right. But those are not organizations geared up, or, they can do enforcement on a regular basis. So naturally, it makes sense to work with the organization which is there, which is the police. It's there in every state. All right. And it's logical. They have the expertise, they have the uniform, they know what to do. The key is to motivate them. So first, of course, we have to tie up with the health department, because COTPA is, and this is a health subject. So, first thing we do is go and do an MOU with the state. And then the health department writes to the police, ki, bhai, look, the law is there, you have to enforce it. We will help you to build the capacity. Our team will come and train you, etc. And then our team gets to work. And then, of course, the whole digital methodology takes over. It's pretty long. I think you personally have seen part of it. But that is perhaps, for another day that we talk about it.
So I have a supplementary
Yeah,
question.
sorry, the second question. So which is, how do we manage 100 rupees or plus? You see, we've actually left it free to the SPs. They decide in their district what is the amount. So we do not insist that you do 100 rupees. In fact, in a number of districts we've had where the SP has said the first 2 months, we will do no chalaning, we will just warn people. In fact, there are political issues. Meghalaya is a tribal state, and in one district, without getting the tribal association involved, it was impossible. The SP was scared to do any chalaning. So it took him 3 months before he started chalaning. And he told us, I'm going to, and we had to spend some time getting the tribal associations, to agree to, yes, this is important for health, etc., etc. And what we have found is that as long as, the frequency of chalaning is more important than the amount. If you go to these villages, Dr. Rakesh, you will find that how many people walk around with 50 rupees in their pocket? They don't. Okay, people in the villages who are coming there, they don't have 50 rupees in their pocket. Now, if you impose a 200 rupee challan, you are not going to get a challan, because in the villages, everybody knows everybody, right? And if the policeman is being unreasonable, there's going to be a very major backlash. We are not talking about people smoking 20 rupee cigarettes. We're talking about the BD smokers, etc. So we leave it to the police. And they themselves decide what is a reasonable amount. So sometimes they do 50 rupees, sometimes they do 100, sometimes they do 200. They are a good judge of that. And the important thing is that if you keep them motivated, then they don't, the corruption angle doesn't come in.
Yeah.
You see, because if they are fighting for a cause, and as Pramod showed you, that not only you see, our focus is to get them committed to tobacco control, not just to COTPA. So we are finding that the police respond very well to that. Of course, how we achieve that is another story. But they not only then, you see, then they don't accept, okay, you bribe me and I will take the money and not for challan you. They are fighting for a cause. Getting them to challan itself is a major, task that they should go periodically. So the numbers also which you're seeing of challans is even now we are only challaning once or twice a week. All right. Whereas our focus is to get them to challan every week. Okay. And then later to make it twice a week. At least twice a week they should go on and challan for COTPA challaning should be done. But that is going to take some time as the police force needs to get committed to this cause also, and that takes its own time to build up. So I don't know if that's answered your question, but that's how we do it.
I need some deeper probing if you allow me that, and if the time permits. Can it be done?
That's up to Dr. Rakesh Chandigarh to tell us.
I think we don't have any shortage of time. We still have 34 minutes more to go.
All right.
So please carry on. Yeah.
Getting MOU with the states is not easy, one. If you are getting an MOU with the health department, the police department is under the home department, no? So how do they get sort of committed to be the part of the MOU? That is an information which I think will help, definitely. And the part of the second question is 100 plus rupees fine is still high. You yourself said that affordability is not there. So how that has happened? So these are my two supplementary questions.
Right. So the first one, by the way, when we say MOUs, we charge for this service. We are not doing it free.
So,
yeah. Of course, we are quite happy if funders come and say, okay, do it in this state and support us. We'll be more than happy to do that. But we are charging all the states where we work, they pay us for this work. So that, of course, is a big, being able to sell to the state is a major challenge. In fact, that's far more challenging than implementation.
yeah.
So, all right. But having done that, once we manage to get the MOU, our VOTV kicks in. And that VOTV is available to all of you. To every other, anybody in tobacco control can call on us. Voice of Tobacco Victims has been one of the most effective ways or most effective tools, if I may say so, to get this started. We have doctors and patients who are willing to come for miles. They drive for 2 hours to come and attend our training program or to come and meet the DGP, to meet the SP. And then all the training programs we do, whether it is digital or physical, our doctors are there, our patients are there. And that really becomes the turning point of, getting the police motivated. In fact, we found that the turning point for toffee also. That once you bring home what tobacco does to you, to your families, that is when the policemen also wake up and realize that we are human beings first and policemen second, and that what we are doing is good for society. So they step in. We have had policemen who are quite happily coming to schools on their own. We don't ask them. They come on their own. They go to villages and they give talks. Look, this is bad. So everybody has some uncle, some relative who has suffered from tobacco. So I think वो अंतरात्मा उनकी जागृत हो जाती है. And then after that, they are putting their, all this challanning on their own in our WhatsApp groups. Every day we are getting, hundreds of pictures coming in. We've done this challanning. See, in Andhra, it's more than 300 challans a month per district. Already 300 challans per district per month. All right. And all of those, usme se 60% is, reported on our WhatsApp groups. So that is the level of motivation which we achieve, which has come in the police.
Great. I think we can go on discussing this more because there's a lot of excitement which you have generated. But I'll just recommend Dr. Rakesh ji that we should have another webinar where we should be talking specifically about how to get the states engaged, what is the cost to it, what are the challenges and barriers, and perhaps I think we
I think
definitely
we can request the Sambandh team to do another webinar with us on this issue.
and
Yeah,
with the leadership from
and
Dr.
we'll be
Rana ji.
working with you too, Dr. Rakesh, since you are very articulate and you ask the right questions also. So, Dr. Ashima, who is the director of the Sambandh Foundation, so any comments from your side, please?
Just Sandeep. Just one thing, I think I've said that on the TC Alliance group also, that if you're really looking at reduction in tobacco prevalence, we need to do things on the ground. Yes, meetings, etc., all are needed, to network and see and share practices, best practices with each other and how to replicate it. But yes, it is important that activities are done on the ground to see the reduction in prevalence, which right now is quite high. And I'm sorry to say this, but we all keep talking about, end game. Let's have that, just single digit prevalence first, and then start looking at that. Yes, I read about it that, group that it is a concept, or there are various definitions. So let's look at first reducing the prevalence with doing some activities on the ground, implementing things, and then let's see the outcomes and then go on to end game. I would be very happy to see it if actually tobacco, there is an end game to it.
Yeah, Dr. Ashima, I think you are right that, first of all, I must thank you for the appropriate answer. But as far as the end game is concerned, I don't think that we need to reduce the prevalence to 1% or a single digit number. So I think both can happen together. So this is my view and Dr. Rakesh Gupta's view as well. So now I'll move to Mr. Ramesh Gandhi. So do you have any questions for Mr. Sanjay, Pramodji, or Dr. Ashima? Yes, Ramesh.
Thank you very much. My compliments to Sanjay Seth Saab, Pramodji and Ashima for a wonderful presentation. And it's an eye-opener how implementation can change the game at the ground. And I have a question that once you decide that you are going to do this project in particular state, though Sanjay Seth ji has already explained that you do it after MOU and you inspire them to do the work at the ground. But my question is that what is the size of your team in a state which motivates them and which works with them?
Okay, that's a good question, Ramesh ji, and happy to see you after a long time. We are, I think, Pramod has, for these 24 districts we are working in, Pramod has including himself, there are 3 people doing this program. 2 of them, Pramod and one more person is sitting in Gurgaon, and we have 1 person sitting in Vijayawada. So that's it. 3 people, we are servicing 24 districts, and the results which you are seeing are being achieved with that.
And you're talking about all the states or one state?
Well, we have been 3 people for these 2 states, 24 districts which we are working in.
Okay. I think this
and we can scale this up. We can manage at least another, we can more than triple this number of districts with the same team.
Oh, very nice. So that means you are doing these wonders with only 33% of your efficiency.
Yes. We are quite, we in fact would be very happy if you can get us some MOUs more signed with states, states who are serious about doing tobacco control. Of course, Dr. Rana may also decide that he wants to, support us to get some more districts or some more states started. And we have no problem in scaling up. We can easily scale up to 600 districts in maybe, say, 1 year's time.
Yeah.
Sure. Rajasthan also needs to enhance implementation, as Dr. Rana said that all the states need to enhance implementation. And as you have said, we can talk after this webinar regarding how we can implement the same module or scale up your project here in Rajasthan and also in other states.
Rameshji, the point is we are talking there are SNOs here, hopefully. We keep talking all the time about tobacco control. If you really want to do tobacco control, all right, first thing is you should be in a position to convince your own, mission director there is a model available, let's implement it. It's as simple as signing an MOU with us. The rest we guarantee. And we don't work alone. If you are joining hands with us, there's a big role for you to play, for both of us to play mutually in this thing. We are open source. Okay? We are very keen on taking our know-how to every district. Ashima and I and Pramod have been working for years on this. You all know us. Right?
Yes.
So we are more than happy to share our knowledge with everybody. We are more than happy to take it to every district in this country. But we need you to convince your own, the people who have got the money and have been appointed to do this program. All right. If they are not ready to get this done, then we can keep talking, one webinar after the other, and nothing really will happen. See, we've been at least in these 2 states, Andhra and Meghalaya. The mission directors have, said, all right, please do it in my state. Here's the money, do it. And we charge very reasonably, very, very little actually.
Okay, very nice. So, in fact,
sorry to interrupt you, but I think we are generating, I have to check, but I think we are generating more in fines than what we charge to them.
Nice. So that's a good economic model also.
So Rameshji, I think Mr. Sanjay has answered your question.
Yes.
So shall we move to Dr. Anyone actually who wants to ask question, they can just ask. We have Dr. Siddhi Hathiwala with us. She's a dental surgeon and an academician. So Dr. Siddhi, are you with us? So anyone who wants to ask questions
yes, sir. Yes, sir, I'm here.
Okay, Siddhi.
Yes, sir, I'm here.
Okay. And any questions?
It was great to hear great work from the team. And also policemen. I have a great respect for all policemen. We see them working in and out. I have been seeing them because they work in public work, also in civilian work and all. My mother was judge in civil consumer forum. I was seeing them there as well. And this was a new aspect when I saw them working for health. So it was a great team effort. It was nice hearing. Thank you.
Yeah. So thank you, Dr. Siddhi, for the comments. And anyone who wants to ask any question from the team, Sambandh, Mr. Sanjay Seth, Dr. Ashima, or Pramodji, you're welcome to just unmute yourself or just put your questions in the chat box.
Dr. Rakesh Gupta-ji has raised hand.
Yes,
yes, Dr. Rakesh.
To know whether you have the publication, because publication can be the best tool we can have to interact with our MD NHM in the state. And yes, we do have an access to her. She is recently told one of our colleagues that bring us some innovative ideas and we would like to implement those. So I consider that there can be an opportunity, and if someone from your team can come, we can definitely arrange a meeting with her so that there is an evidence along with this the persons who have done it. If that can be done, Rajasthan can be another state and we can work in a collaboration. Not me as such, but Rastofa, our Tobacco Free Alliance, can work. Ramesh Gandhi is the chairman. So I think they can take it up.
And Dr. Rakesh, thanks for
Very
sharing the
happy
link of the
to
study.
fix up the meeting. We'll be there. Give us 1 day notice because Jaipur we need at least a day's notice. Okay, you fix up the meeting. We will be there as evidence publications. See, unfortunately, that's where we need your help, Dr. Rakesh. I've discussed this with you also. We've been more focused on working and not on publishing our work. So we definitely need more publication. COTPA, we've definitely not published anything. Toffee we have. But much less, I mean, very little we have published. But I can get you do better than that. Okay, if you fix up the meeting, I will get a references, even put, on the, I connect the MD of NHM of the states we are working in to talk to them. All right. Or they can, facilitate that they can talk to each other and get references.
So
and by the
prepare
way,
with
we
your
are
documents.
in COTPA, we are working only in these 2 states, but in Toffee and in other programs, we are working in 5 states now. So, they know our digital approach, they understand, even if it is not in COTPA.
So although I am just a member in Rastofa, but let me suggest that you prepare your submission papers and we'll work at our end. Rameshji will take it up and he and Rajan Chaudhary can definitely get the schedule from the MD NHM. The only issue, and if Rana ji, who is well known to our state and who is also our champion leader in a way, if we can all be together, I think it can be a very fruitful initiative in Rajasthan as well. Great.
Dr. Rana, you have promised to bring your team and visit us. I'm waiting. All right. You did not issue us a reverse invitation, I cannot say I will come. But
in fact,
either case, I'm waiting.
Yes. No.
Yeah. Sanjay ji will have concluding remarks
because
from
of our
Dr.
that
Rana.
whole transition work from union to vital and then setting up of our office and all establishments. So really, yes, sir, I am planning and maybe very soon we will have that meeting. Yes.
Yeah. So Dr.
Thank
Rakesh,
you.
do you have to say anything and any more questions? You're muted.
No, I think this is fine. I think otherwise I'll be asking questions. I always have more questions.
Actually, Sambandh is doing an excellent job.
Think
actually,
if we have agreed.
Yeah. No.
I think if we have agreed for another webinar, then I will not ask any questions today.
So I think we'll invite them for another webinar.
Yes.
Yeah. So any more questions, please, from the participants? Or we can have concluding remarks from Dr. Rana Singh. So we'll wait for another minute.
Dr. Rakesh Gupta ji do. But any questions? Any questions related to enforcement, reporting?
I think you can carry on with your concluding remarks. Yeah.
Maybe I would request Dr. Rakesh Gupta ji.
Okay, thank you. Yes, one of the things which I wish to share is that it's almost 7 years I know of a model in Rajasthan that Rajasthan with a poor girl-child ratio has been able to reverse that ratio to be on the positive side only because of the engagement of the police department, who had the unit established in the Directorate of Medical and Health Services, and therefore the enforcement of the PCPNDT rule became easy. I have been suggesting that to our state cell that since we already have a model, we can work with the same team or maybe have 1 or 2 members more who can work for COTPA enforcement coordination and do the enforcement in the state in a better manner. Somehow that has not happened. Now that is in a way kind of matching with the model that Sanjay ji's team has shown here. And I think I do feel that the policemen can be most influential to have the right kind of implementation, the one that we foresee can reduce the prevalence of tobacco. But I also know that the police department and its people are really very much hard pressed to do several other tasks. And in several interactions that I have had with these top police level officials, top level officials, they consider that COTPA is, they have admitted that COTPA is something which is last on their list, and they do it whenever the campaigns are held or when we as NGOs request them to do. Sporadically, they will do the enforcement drives. So I think that the time has come where this model gets replicated in the state, and it cannot happen unless we have the funders agreeing to it. And there's no dearth of funders actually, even if we think that government may not give us the kind of support it requires, but people have to know that where their money is going. So we need to really think of having a document prepared, do more workshops which are related and focused only on COTPA enforcement. I have always felt, based on what Sanjay ji has often said, and drawn an analogy of road traffic accidents as to, despite the larger number of vehicles running on the road, the number of deaths are comparatively much less as compared to the deaths related to tobacco. And I have always been saying to him that, to which he is not agreeing to entirely. I said penalties should be such that they become deterrence, which unfortunately have not happened because the COTPA could not be amended and has been in the cold storage for over 10 years now. So I think, yes, this appears to be a way out. And if the people can work without the amendment of the COTPA for increasing the penalties, to me, this appears a good model to work with. And if it can be done with such a small team, and as Ramesh ji has observed that it is one team, one-third utilized for its capabilities, I think it's a great model, but we need to know more about how the MOUs are working, how the people get motivated, how the police personnel get motivated to do so. I understand that, yes, WhatsApp group works very well, but it cannot be the only thing. There have to be several other aspects, and I think those requires to be analyzed as a research project. I would say everything need to be led threadbare so that we can learn out of it. So it's a great learning experience as well, and I'm thankful really to Sambandh team and the innovation you have brought in the tobacco control. And I'm sure Dr. Rana ji will take it up with his vital strategy team as a model. You know, it's a model to be displayed from the country. It's one of the good case studies. And I think that requires to be prepared. So I hope Rana ji will visit your office and will definitely get more insights, and some kind of case study we must prepare to be presented internationally. The World Conference on Tobacco Health is coming up. I don't know whether you have submitted a paper to it as for the DPI. Many of us have not. I think most of us have always been thinking of how to get the fund to attend such a conference. But if even now there is a kind of leverage and something can be done in one of the workshops or webinars, you guys can be sort of supported to go there and present your work. I think we must not miss on that opportunity. That is all I have to say right now. I will request Dr. Rana ji to comment on my observations.
Thank you, sir. Thank you very much. I think I always say that if you ask me what is our role right now in tobacco control, it's learning from one place, and if it is really good, how it can be replicated and how it can be shared with others. So in tobacco control, it's not like diagnosis of TB and treatment of TB, but it's something which is variable across the country. Enforcement system is variable across the country. The way people enforce, the way people behave to all those issues, that is again variable across the country. So we every state and within a state, every district is a challenge. They have different ways of working. So I think these are first of all excellent work. Secondly, I think, excellent case studies. We always document best practices in already under our source center for tobacco control. So we record all those best practices. But definitely your point about publication, so that is very, very crucial. Even in the beginning, I still remember why we thought of involving academics, why so many universities, almost so many aims are part of tobacco control, because we people, we are mainly busy with our lot of work at grassroots level training or other. But when we involve academics with us, so at that time, then many opinion polls, many compliance assessment studies that were done. So people like Dr. Goyal and many other universities, so they publish out of that. Otherwise, there was no reference. Now, if we want to, we want to have some publication, we are preparing some manuscript and want to have some references as far as enforcement is concerned. Definitely, you will get some references from India also. Uh, so really important work, but definitely reporting and recording publication is really also very, very important. So we will see. So we will sit together and I think find out the ways how that can be scaled up. But definitely, as Sanjay ji mentioned, so support from local people, local authorities. So that is very, very crucial. So even in for Rajasthan, how TOFA, Tobacco Free Alliance, Rajasthan Alliance, so can help in that you can say coordination with the state authorities and implement this experience. So thank you very much, sir.
So thank you, Dr. Rana, for your concluding remarks. And if anybody else has to say anything, otherwise we'll just move to vote of thanks. So we have with us our intern, Tamanna ji. So she will propose a vote of thanks. Thank you. Yes, Tamanna.
Good afternoon, everybody. On behalf of the organizing team, I extend my heartfelt gratitude to all the participants for being part of today's presentation. First and foremost, I want to extend my gratitude to Dr. Rana Singh, Director of Tobacco Control, Southeast Asia, Vital Strategies, for sharing his expertise on advancing tobacco control policies. Our thanks also go to Dr. Sandeep Bhalla, Vice President of ECO India, for his enriching contributions and experiences in capacity building initiatives and public health leadership. To Mr. Sanjay Seth, Trustee and Chief of Operations, Sambandh Health Foundation, your extensive work on tobacco control and the voice of tobacco victims campaign has truly paved the way for impactful change. To Mr. Pramod Kumar, Project Manager, Sambandh Health Foundation, for sharing practical insights into implementing COTPA across various districts using innovative digital tools. Dr. Rakesh Gupta, President and Director of Public Health CIPHER, for his visionary leadership and invaluable insights that set the tone for today's session. A special thanks to Mr. Rajiv Kumar, Project Coordinator, PGI Chandigarh, for welcoming the participants. To all the participants and attendees, your presence and engagement made this session truly meaningful. We hope the discussion today inspire future actions towards creating a healthier and tobacco-free future. Thank you all once again, and let us continue to work together toward impactful change in public health.
Thank you, Dr.
Thank you all for
thank you,
joining.
Sanjay sir.
And
Thank you,
special
Dr.
thanks to Dr.
Thank you,
Rakesh
Dr.
Gupta,
Rakesh
Mr.
ji.
Ramesh Gandhi, Siddhi
Mr. Pramod,
Hatipala,
thank you very
and
much.
all the participants for joining.
Thank
So
you.
we have been able to finish off
Thank you,
the
Pramod ji.
webinar in time here.
All
Thank
the
you.
participants.
And thank you for the organizing team as well.